Hello beautiful people, I'm back again with a new video. Trust you have been doing great. It has been a while. In today's video I'll be talking about common medication errors made by parents. Common medication errors, do I say made by some mothers, some parents, because my subscribers are smart super moms. After watching this video, you will find out that it's very helpful and it needs to reach out to many people. So I'll start by telling you a story of a lady whose child had a common cold. You know that the drugs for common cold, you can easily get them from patent medical shops. Paracetamol is contained in lots of combination drugs. Getting to the patent medical store, which is also known as chemist in Nigeria, the drug she wanted to buy for the child was not available, but the man at the chemist shop told her that he has some drugs which can be given to this child and he will be relieved faster. So she said, okay, give me the drugs. And guess what? He gave the woman Fluj and also ibuprofen. It's just like giving the person the same drugs, even though Fluj has other contents, but emphasis now is on the paracetamol contents of Fluj. Now, what's the work of the paracetamol? The work of the paracetamol is to reduce the body temperature and also to relieve the child of whatever pains that he or she has. What is the work of ibuprofen or paracetamol? Ibuprofen. The work of ibuprofen is also to relieve pain and also to reduce the body temperature to normal. Now, you're giving the child the same drug at the same time. Isn't it drug abuse? This is drug abuse. And that instance is when I gave birth to my first child and people were coming to visit me. You know, some people would be like, we have been on this game. Like, even though you are a nurse, we have been here before you, we have been giving birth before you. Like, we are the one to teach you. So someone actually told me that I should get teething remedy for my child. I should start early to give her teething remedy. I said, why do you want me to start giving my child teething remedy? She said, I should give my child teething remedy so that when she starts teething, this child will not have any problem. What is the content of this teething remedy? For instance, baby rest is a teething remedy. Piccan. So when you check some of this teething remedy, you find out that they contain paracetamol. And let's say, for instance, a particular bottle of teething remedy you bought is 100 mils. Now, this mother will keep giving the child this teething remedy which contains paracetamol till the whole 100 mils is exhausted. That means, how many milligrams of paracetamol have you given your child within that period of time? This is drug abuse. You are simply abusing the drug paracetamol, and it has an adverse effect in the body, which I'm still going to tell you on this video. So let's say, for instance, this child is going to have these symptoms when she starts teething. Can the paracetamol you give today stop the fever or whatever pains the child will have in the future when the child? Answer is simply no. So then why do you give paracetamol? Why do you compound problem for the child? The paracetamol you give today will not prevent this child from having teething symptoms. If at all this child will have any symptom which you feel is associated with teething. Okay, let's look at a woman whose child is having fever. Your child is having fever and you know that paracetamol, when you give your child paracetamol, it will reduce the body temperature. You say, okay, let me give my child paracetamol. At least when I give this child paracetamol, the fever will calm down, the body temperature will come back to normal. Good, you took the right steps. You have given this child paracetamol and the fever left her. The fever left he or she and your child becomes normal. Maybe by tomorrow or later in the night, this child will start running temperature again. You will give paracetamol. You keep giving paracetamol each time the child runs temperature. What I want to let you know is that what the paracetamol does is to calm the body temperature. It doesn't remove the causative agent. For this child to have fever, it shows that this child might have bacterial infection, the child might have viral infection. There are a lot of things going on in the body that it shows that there's a medical condition in the body which needs medical attention, and you were basically giving paracetamol at home. Paracetamol cannot treat bacterial infection. Paracetamol cannot treat viral infection. What it can do is just to reduce the body temperature, and you keep giving the child paracetamol. In most cases, you find that a woman will keep giving paracetamol to her child for over 1 week. By the time she finds out that the condition is getting out of hand, she will hurriedly take the child to a health center or to any hospital that is nearby for treatment. Now, when you ask her, how long have your child been having a fever? How long has your child been having those symptoms? Her answer will be, it has been over 1 week. So what have you been giving to this child? Paracetamol. Paracetamol for how many days now? Now, if you are observant, you will find out that most times when you go to hospital, they prescribe paracetamol for you. It's usually for 3 days. But now you at home, you're treating your child for over 1 week. You're still giving your child paracetamol. You are doing more harm than good to that child, and that is why I'm making this video today, to correct this. Most of my subscribers are super parents. They are so smart. So please help me to reach the right audience. Help me to reach them by sharing this video out. Now we all know that paracetamol is one of the commonly used analgesic and antipyretic because it has an excellent safety profile when given in proper therapeutic doses, and it can cause hepatotoxicity when it is misused. So when you take paracetamol, what paracetamol does is to reduce the body temperature and also to relieve you of whatever pains you're feeling. After that, the paracetamol is being inactivated and removed from the body. How? 20% of it is 20% of it is processed in the intestinal walls. The remaining 80% is processed in the liver. So during this process, this paracetamol forms a toxic compound, and this toxic compound is being detoxified in the liver by glutathione. And in a situation whereby there is paracetamol overdosage, the glutathione in the liver is being depleted because it will not be enough to detoxify all the toxic that are formed as a result of the paracetamol overdosage. So what happens to those toxic compounds? Since the liver cannot be able to detoxify it, since the glutathione in the liver is not enough, it has been depleted, it's not enough to detoxify those toxic compounds. What happens to the remaining ones? They continue to build up in the liver. As they continue to build up in the liver, it causes liver failure. Have you seen why I said that you are doing more harm than good to your child by continuously giving this child paracetamol? Now, the points to consider to avoid giving your child paracetamol overdosage is to be a label watcher. Whenever you buy a combination drug and maybe your child is also supposed to take paracetamol, ensure you check the label, read the contents of that drug which was given to you to find out if the drug contains paracetamol. If this drug contains paracetamol, you don't need to give your child extra paracetamol. You don't need to give your child ibuprofen, any form of pain relief. You don't need to give to your child. And another name for paracetamol is acetaminophen. So in that combination drugs that you bought, check if any of them contains acetaminophen. If it contains acetaminophen, it simply means that this drug has paracetamol in it, and you don't need to give extra paracetamol. Okay? Also, ensure that you keep all medicine out of reach of children, because if you don't keep it out of their reach, this child may drink the medicine, in fact finish the whole content of the bottle before you could even notice what is happening. It is finished. Like so that is why you should always keep all medicine out of reach of children. Always give the correct dose that was prescribed, or follow the instruction which the manufacturer has given on the label. Follow the manufacturer's instruction, follow your doctor's instruction. Don't say, this fever is too much, or this fever is too much, if for instance they say you should give your child 5 minutes, this fever is too much, let me give her 10 minutes. 10 minutes will help to calm it faster. You're just harming your child. Please give the correct dose, give the accurate dose that you were asked to give to your child. And if symptoms persist, please quickly take your child to the hospital, take your child to the health center, anyone that is near to you. Quickly take your child to the hospital. Say no to paracetamol abuse, say no to paracetamol abuse, and please stop harming your child. Okay, thank you for watching to this point, and please give this video a massive thumbs up. If you have not subscribed to my channel, please kindly do so by hitting on that red subscribe button. It's absolutely free of charge. No other cost is attached to you subscribing to my channel. So